Well, good afternoon, everybody, and thank you for joining today's press conference. As of today, we have had 1,003,243 COVID cases, 268 new cases reported since yesterday, 602 people in the hospital, and sadly, 13,101 people who've died. Even as more people receive the vaccine and life returns to a more normal pace, many of our fellow North Carolinians are mourning the loss of family and friends, and we still hold them in our thoughts. While we still have people getting sick and dying from this disease, cases, hospitalizations, and percentage of tests positive are decreasing as vaccinations are increasing. And we're working on new ways to get as many people vaccinated as possible. Today, almost 80% of people 65 and older have been vaccinated. That's great news because that's our most vulnerable population. Children as young as 12 are eligible, and we're glad to see young people who want a vaccine so they can stay safe from this virus. And that's more help for our plan to have all students in North Carolina be able to attend in-person school this fall. The North Carolina Department of Health and Human Services has begun pilot programs in 4 counties offering $25 cash cards for anyone who gets vaccinated or drives someone to get their shot. The results show that the financial support is making a difference in getting more people vaccinated. We're glad to see private businesses, schools, and community groups sponsoring vaccine events on site, and we continue to explore other creative ways to bring people in. Right now, I'd like to ask Dr. Mandy Cohen, our Secretary of the North Carolina Department of Health and Human Services, to share an update with us. Dr. Cohen.
Thank you, Governor. While there is more work to do, vaccines are helping us to turn the corner of this pandemic. More than 4.2 million North Carolinians have done their part to protect themselves, protect their communities, and help move us forward so we can get back to the people and places we love. As of today, as the governor said, 53% of North Carolinians 18 or older have received at least 1 dose of the vaccine, and 80% of those 65 and older have received at least 1 dose of vaccine, and that's great progress. We continue to use data to drive our vaccine work. Our new tool that maps social vulnerability and vaccination rates by census tract has helped North Carolina vaccine providers increase vaccinations by 50% in 89 underserved communities since the end of April, and that's another piece of good progress. Vaccinations have had an impact on our COVID trends. As the governor mentioned, the number of people going to the emergency room with COVID-like illness continues to decline. Cases are at levels we haven't seen for more than a year. The percent of tests that are positive has been under 5% for more than 3 weeks, and hospitalizations have decreased dramatically over the past month. In addition to protecting yourself from COVID-19 and virus-related hospitalizations and death, getting vaccinated means being able to do all of the things that you did before the pandemic. If you're unvaccinated, remember that you still need to wear a mask in public indoor settings and public outdoor settings when you can't maintain physical distance. If you haven't been vaccinated, you also need to quarantine if you are exposed to someone with COVID-19, and you need to participate in testing and screening programs. To make it as easy as possible for people to get their vaccine, as the governor mentioned, we are offering $25 summer cash cards at select vaccine sites to offset the time and transportation costs of getting vaccinated. Through June the 8th, summer cash cards are available in a pilot program locations in Mecklenburg, Guilford, Rowan, and Rockingham counties. Anyone 18 and older who gets their first dose of a COVID-19 vaccine or drives someone to their vaccination at one of these participating locations can receive a $25 cash card while supplies last. In the first week of the pilot program, we distributed almost 1,000 cards to vaccine recipients and more than 375 cards to drivers. Surveys are showing that the financial support is making a difference. More than 40% of people said having someone to drive them was a very important reason that they got vaccinated at one of these summer cash card events. And almost a quarter of the people surveyed said that the summer cash card was a very important motivation for getting vaccinated that day. The Summer Cash Card pilot is part of our Bringing Summer Back, Get Out the Vaccine campaign, with more than 275 organizations, agencies, and businesses signing on to promote COVID-19 vaccinations in their community. We have a strong supply of COVID-19 vaccines in North Carolina, and it's free to everyone. For those who still have questions, please take the time to learn about COVID-19 vaccines and why they are safe, effective shots, and are your best shot at getting back in control of your life and back to the people and places you love. Visit yourspot.nc.gov for answers. And remember, vax up or mask up. Thank you, Governor.
Thank you, Dr. Cohen. As we continue to see the amazing results from these effective vaccines, please keep talking to your family, friends, and neighbors and encourage them to get their shots. Though a lot of the economic fog caused by this pandemic is lifting, many families across the country are still hurting. To support our neighbors, North Carolina created the HOPE program last year to provide assistance with rent and utility payments for families that are struggling to make the payments. We knew that tough times meant demand would exceed funding we had available, and we saw a flood of applications come in very quickly. Ultimately, the program awarded more than $133 million in assistance to help more than 36,000 families statewide. But we knew that demand outstripped the resources and that people still needed help. And it was good to see that Congress followed North Carolina's lead in recognizing this and providing additional funds. 2 weeks ago, North Carolina opened a second application period for the HOPE program using funding from the American Rescue Plan. And I'm pleased to announce that checks are already on their way to landlords and utility companies to keep people in their homes with the lights on. As of today, 924 checks for a total of $1.1 million have already been mailed to help North Carolinians in need just in the first 2 weeks. This second version of the HOPE program is serving low-income renters in 88 North Carolina counties, 12 additional mostly larger counties, and 5 tribal governments received money directly from the federal government to operate their own programs. But no matter where you live, people needing help can just call one number, 888-9-ASK-HOPE, or visit www.hope.nc.gov to apply. Previous applicants who received help can reapply if they still need assistance. And as with the first version of the HOPE program, payments will go directly to landlords and utility companies. In the last 2 weeks, more than 8,000 people have already applied for financial assistance, and we expect more checks to go out every day. I appreciate the work of Laura Hogshead and her team, Mike Sprayberry and his team, and so many others, and what they've done to build capacity and get these funds to those who need help. Now we need to get the word out. I'd like to ask Laura Hogshead, who is the Chief Operating Officer of the North Carolina Office of Recovery and Resilience, or NCORE, to share more about this program. Laura?
Thank you, Governor. I'm honored to be here today on behalf of the North Carolina Housing Opportunities and Prevention of Evictions, or HOPE program, to discuss the opening of a new application period for rent and utility assistance. As with the first phase of the program, HOPE remains focused on promoting housing stability by preventing evictions and utility disconnections while families across the state recover from the COVID-19 pandemic. The HOPE program team has been hard at work improving and streamlining the application process, making it easier for people to quickly get the rent and utility assistance they need. We've greatly increased the number of support staff and added a call center dedicated to assisting program applicants. While the program was able to serve 36,000 households during Phase 1, we know that more people need help. We look forward to helping even more North Carolina families through this second phase of the HOPE program. As Governor Cooper said, HOPE assistance is now available to very low-income renters who have lost income, been unemployed, or experienced financial hardship due to the COVID-19 pandemic. This includes people who have missed rent or utility payments at some point since April 1st, 2020, or have been faced with homelessness or possible eviction. You do not have to be late on your rent when you apply in order to qualify for assistance, and being late on an essential utility sometime since April 1st, 2020 qualifies you as being at risk of eviction or homelessness. For people who previously applied to the HOPE program, whether you received assistance or not, you can reapply during this application period if you still need help. Reapplicants should check their email for more information. As the governor mentioned, in addition to the HOPE program, 12 counties and 5 tribal governments are operating their own emergency rental assistance programs. If you are not sure whether to apply to the HOPE program or a local program, you can get that information at www.hope.nc.gov or by calling 888-9-ASK-HOPE and speaking with program specialist. You'll also find detailed program information and an online application at www.hope.nc.gov. On behalf of all the staff working behind the scenes on the HOPE program, we look forward to serving and supporting the people of North Carolina through this important program. Thank you, sir.
And thank you, Laura, Ryan, your team, Secretary Hooks and Mike Sprayberry, everybody who's working really hard on this. It's important. I strongly encourage landlords and utilities across our state to lend a hand to their communities and to participate in these programs so that we can keep people in their homes with the lights on. For many, life is starting to look more normal, and more people are returning to the workforce every day. But child care obstacles and concerns about the virus for people who are unvaccinated are very real, and the need for rental and utility assistance remains. I'm real proud that North Carolina is taking steps to support families who need it as we emerge from this pandemic. Also with me today is our Secretary of Public Safety, Eric Hooks, our Director of Emergency Management, Mike Sprayberry. Monica McGee and Mark Lineberger are our sign language interpreters, and behind the scenes, Jackie and Jasmine Matirvier are our Spanish language interpreters. We have a couple of reporters in person present here. We're going to take a couple of their questions, and then we're also going to go and take some remote questions from reporters who are on the phone line. So we'll begin with in person. Yep. Thanks.
I'm Vaughn with the News and Observer. First off, I wanted to find out where things stand with what happened with Delegati today, and if you're searching for another nominee, and then with where we are with vaccinations and incentives, and maybe some flexibility with the money from the federal government that you can use. Are there other incentives at play? And of course, I have a follow-up.
First, Secretary Dion Delegati is well qualified to serve as DEQ Secretary. She is a scientist, she is a veteran, and she has years of experience in environmental and energy policy. I would hope that the Senate would not vote on this tomorrow. She is well qualified to handle this job and to do the job. And I'll say this to anybody who's listening, any lobbyist or whoever, that nothing's going to stop this administration from working toward a clean energy future for North Carolina and protecting our air and water. As to the second part regarding vaccines, we're continuing to look at ways to incentivize people to get vaccinations. And we've looked very closely at the drawings and other promotions that other states have done and have looked at their results. And hopefully we will be following some of their lead soon. We're gonna continue to examine it, continue to work through potential legal issues, discuss things with the legislature, the Council of State, other state agencies to do what we can do to get more people vaccinated.
Do you think, and is that tied to how long the state of emergency needs to continue?
Oh, sure. The state of emergency needs to continue. We need to continue to draw down federal funds. We need to continue to do things to make sure that we get people vaccinated. We still have mask mandates in places that are recommended by the CDC. Many other reasons to maintain the state of emergency at this time.
So the mask order at schools ends like right about, or at least like the end of the school year for Wake County. Are those dates tied together? Is there going to be something else with the masks in schools and other places through the summer?
So I'll let Dr. Cohen address the mask issue. Dr. Cohen.
Thanks for that question. So we continue to recognize that the vast majority of students are unvaccinated. It was just a few weeks ago that we were able to get those who are 12 and above vaccinated, and we think that folks should go out as quickly as possible and make sure you're getting vaccinated. But the CDC continues to recommend that those who are unvaccinated, that they wear a mask indoors. That includes the vast majority of our children who are in K-12 schools, and that will continue until the guidance changes from the CDC. So we will, of course, reevaluate governor's executive orders and be able to change our guidance if anything would to change from the CDC. But right now they continue to say that those who are unvaccinated should continue to wear masks indoors, and that will include our children. Thank you.
Yes.
The North State Journal News Observer's Don Vaughn. Quick question, just to clarify, the state of emergency order, you're saying that it needs to continue, but what metrics, what has got to be in place before you dismantle that executive order? I mean, it's been in place since March 10th of last year. And a secondary question, in terms of the vaccinations, we've seen all these, we're seeing the pilot program with the gift cards and a possible lottery situation like other states and that sort of thing. And there's been a lot of mention of equity when it comes to vaccine distribution, but I was wondering if you could define what you mean by equity, what you believe equity to be.
Okay. Well, first, this has been a once-in-a-generation occurrence with this pandemic. And it has, since it's been such an extraordinary event, it's required an extraordinary response. The state of emergency has been able to help us free up resources, personnel, to be able to waive regulations in order to stem the tide of this virus, to help get people vaccinated. We are still in the middle of this pandemic. We still have a large number of North Carolinians who are unvaccinated. We still have people in the hospital and dying every day. So there is more work to do to get us to the end of this. When I talk about equity in vaccinations, everybody should have an opportunity to get vaccinated. And we have seen many underserved communities who have suffered from the healthcare systems in place. People don't have health insurance. They can't go, it makes it very difficult for them to go to a doctor. Consequently, it's more difficult for them to make the decision and to go get vaccinated. And I think the department has done a good job in trying to reach out to those underserved communities to get more people vaccinated. We still don't have vaccinations that match our demographics yet, but they're working on it. And Dr. Cohen, if you would want to give a more answer to that, you can.
Sure. Just to build on what the governor was saying around equity, and yes, it is about access in every community. That has been a priority since day one, rural, urban communities across our state. So we have really made it a priority to make sure that we have vaccine access all across our state. And what you can see if you go to myspot.nc.gov is really those access points everywhere in our communities. But I would also say that we've spent a particular emphasis on making sure our underserved communities communities, historically marginalized communities, our African American communities, our Hispanic Latinx communities, our American Indian communities, particularly are getting access to this vaccine, because we have known that this, unfortunately, COVID-19 has had a disproportionate impact on those communities. What I'm very proud of is you look at our data, you can see that we are vaccinating at a rate that is near proportional to those folks in our population. We have more work to do. I'd still like to make sure that we are reaching even more folks in our underserved communities. It's exactly why we are doing things like improving access points, like doing the summer cash card, because we know that folks, it is challenging to take time off from work and to go get these vaccines. We want to make it as convenient and easy as possible. But I'm really proud that the data that we have collected is driving our work in an equitable way. Thanks.
One more quick follow-up just about schools. This might be Secretary Cohen's wheelhouse. A lot of parents are asking why their children still need to remain masked in schools. We know the CDC has given this guidance that they should remain masked in schools, but with teachers having been in the first wave of vaccinations in the state, is this going to continue into fall? A lot of parents want to know, is my child going to end up being masked in the fall? And I think that they deserve an answer for that. Thank you for taking the time.
Sure. As I said to the other question, so we continue to know that everyone under the age of 12 is not eligible for vaccination right now. The CDC continues to recommend that everyone who is not vaccinated to continue to wear masks. So that means the vast majority of children are unvaccinated. And again, we can continue to recommend wearing masks in those situations. I think we will need to see as the summer moves along. It may be possible that vaccinations will be available for our younger students. I think it'll be later into the fall before that vaccine eligibility becomes possible. We also may learn more, and we've always said we will incorporate new information. If there are any new guidance that comes from the CDC, you see that we act on that very quickly here at the state level. But as of right now, we want to be sure that we are protecting our students and making sure that those who are unvaccinated are wearing masks. So that is what we will continue to do, and do stay tuned as we learn more, and we would update guidance as we go through the summer. Thanks.
We'll now take some questions from our reporters who are dialed in remotely. Do we have any?
Our first question is from Brian Anderson with the Associated Press.
Hi, Governor. Hi, Dr. Cohen. Brian Anderson here with the AP. Thanks for taking the time. Governor, you said earlier that it appears that there's some benefit. You said the financial support is making a difference in getting more people vaccinated. And I remember a couple months ago just asking, is North Carolina going to do something similar to West Virginia? And you said the word soon. I'm curious, what does soon mean? When can we expect an announcement? And will it apply to people who have already gotten vaccinated or people who haven't yet gotten vaccinated?
Thanks for that question, Brian. And we are still examining what's happening in other states, studying the effectiveness of it, and working to see if we can put something in place in North Carolina that will work for North Carolina as well. And we want to make sure that everything is done right legally, and that we make sure that we approve something that works. So those questions will be answered when we get to a point when we're ready to propose something. We are having conversations with other leaders throughout the state. We think that it's important, however, to use more incentives. We've been encouraging private companies to give incentives. And Dr. Cohen and I just went to Rockingham County and visited a business there that was offering cash drawings for their employees who were getting shots, and that was drawing more people in. So we're encouraging this across the state. The cash cards seem to be working, and so we're going to continue to examine what the best ways are to get more people vaccinated. We know we have more work to do.
Next question.
You have a follow-up, Brian Anderson, Associated Press.
Thanks for that. And I had a follow-up, just a question for Dr. Cohen regarding the pace of vaccinations. We've seen it slow down, and at the current pace, I remember there was that goal of getting 2/3 of adults at least partially vaccinated with at least one shot. and we appear not even close to that. It would take months and months at this level. I'm just curious, what's going to be the thing that changes that? And when you see North Carolina sort of in the bottom 15 of the 50 states as far as vaccinations per capita, what would you attribute that to?
Well, thanks, Brian. You know, I really see the folks who continue to be unvaccinated in three groups. I think there are still folks who it has been hard because of their work schedule, life schedule, to find a vaccine site and an appointment that makes sense for them. So I think that there are still quite a number of folks who are eager to get a vaccine and just haven't been able to make the time to do it. We hope that our actions of making it easier, compensating them for travel time, for missed work time with something like the summer cash card, all of those things can help. I think that there is a group of folks who have real questions about the vaccine. We want to make sure that they get good answers to those questions. We want to make sure that they can talk to their doctor, maybe get vaccinated at their doctor's office. We know from talking to others that they often, if they are not vaccinated, want to get vaccinated at their doctor's office. So again, working with our providers to make sure they have vaccine on the shelf, can have those conversations. So there are folks who have questions. And then there is a group that, you know, continues to articulate that they do not intend to get a vaccine. We're hoping to make that group as small as possible. But we are just going to keep at this, and I appreciate the governor's support to take a look at all data from other states. What are they doing? What are the things that are working? We do our own research here to understand what can continue to motivate folks. How can we make things even easier? That's what we're doing with our Bringing Summer Back campaign, raising awareness of this, encouraging businesses. So we're pulling out all the stops to try to make sure that vaccines are convenient, they're easy, that folks can access them, give some additional incentives beyond the fact that they protect you and your community. And so I'm still hopeful that there is progress for us to make here, and we need to all work together. And I know North Carolina has done that at every turn as we have fought back this pandemic, so I know we will continue to make progress. Thanks, Brian.
Next question, please.
Our next question is from Garrett Bergquist with Spectrum News.
Good afternoon, Governor. Garrett Bergquist with Spectrum News 1. Returning to the Delegati nomination situation, two questions from that. One, Senate Republicans said they were concerned that she was not able to answer questions specifically dealing with infrastructure vulnerabilities. Now, some of your allies on the Democratic side of the Senate are saying, well, that's not exactly in DEQ's wheelhouse. Wanted to get your take on that criticism. And then second, if the Senate does vote not to confirm tomorrow, where does that leave us, both in terms of interim leadership of DEQ and in terms of your nomination for a full-time secretary?
First, this doesn't have anything to do with her knowledge or qualifications. She is eminently qualified to do this job. It has everything to do on whether we're going to have a clean energy future and whether we're going to protect our air and water. And whatever happens here, I'm going to remain committed to protecting our air and water and to a clean energy future in North Carolina. I would hope the Senate would delay this vote. She was there in the meeting today to answer any questions that they had. She testified 5 weeks ago, and they said they were going to bring her back, but they never did. This isn't about what she knows. This isn't about her qualifications. This is about whether we're going to have a clean energy future for North Carolina and whether we're going to be able to protect the air and water of the people of this state. And I would hope and ask that they delay this vote and give her an opportunity to clear up anything that she needs to clear up with them. I fear, however, that it doesn't have anything to do with that. Next question, please.
Our next question is from Rose Hoban with North Carolina Health News.
Hi, folks. Thanks for taking my question. I have a couple. It's two different types of questions. One is, do you have a sense of how many households have taken advantage of the eviction moratorium and would be at risk for eviction once it expires? And what are you going to do? I mean, I know you talked about your programs earlier, but what are you going to do to avoid a housing crisis once that eviction moratorium expires? Will the rental assistance be enough to avoid a crisis for all of those folks, especially because, I mean, if people have to move, there's a real lack of affordable housing. So, what's the landscape there?
So I'm deeply concerned about people who may be evicted from their home. I do think that the order that we've had in place has helped. It obviously doesn't cover everybody, but it covers a lot of people, and I think it has helped. In addition, I think that the HOPE program has helped and will continue to help. We have asked the General Assembly to use some of the American Rescue Plan money to help us with affordable housing. This is one of those issues that the pandemic is shining a light on. It's already a challenge. Affordable housing, already a challenge for us. The pandemic has magnified it. So not only should we continue funding this HOPE program as a temporary help, we also need to invest in affordable housing across our state. And I hope that the legislature will look seriously at the proposals that we have made. Next question.
Follow-up, Rose Hoban, North Carolina Health News.
Thanks for taking the question. This is a different topic. In Ohio, they crunched the numbers to find out that their vaccine lottery system would pay for itself if they avoided only 40 ICU admissions. What's the cost-benefit calculation that you folks have made?
Well, first, we haven't proposed that yet, but that kind of comparison makes sense to me. The more people we get vaccinated, obviously you got to look at the fact that you will be saving lives. That's the most important thing. But also we do know that people who get sick with COVID, and particularly who go into the hospital and have ICU care, that can be very expensive as well. And in general, usually everybody bears the cost of increased cost of health care. Dr. Cohen, would you want to comment on that? Okay. Next question, please.
Our next question is from Jason Marks with WAVY.
Hey, Governor, thanks for taking my call. This is not dealing with COVID. It's dealing with the conversation you just had with the folks from Elizabeth City. Can you talk about the meeting you just had with them, what your message was to them, and your message to Elizabeth City, the Pasquotank community, who feel that maybe justice still hasn't been served for Andrew Brown?
So it was an amazing meeting with committed people who are searching for justice. And the Attorney General and a number of legislators and I heard their concerns, not only about the killing of Andrew Brown Jr., but also about other incidences that occurred in their lives because of the color of their skin. We talked about the recommendations of the task force that I appointed, the task force on racial equity and criminal justice, how we should have a special prosecutor in cases of police shootings, that the camera footage should be public record, and many other issues that are being debated over in the General Assembly, that are being implemented in state law enforcement offices. So I appreciated hearing from them. It's clear that we have a lot of work to do to fight for racial justice, not only in the criminal justice system, but in education, in healthcare, in economics. And I'm committed to working with them and others to do that. Next question, please.
Our next question is from Ashley Talley with WRAL.
Hi, thanks for taking my question. I wanted to revisit Rose Hoban's question about, do you know or have an estimate on the number of people who have been helped by the HELP program or by the eviction moratorium? And do you have any plans to extend that moratorium past June 30th?
I'll answer the second part first. We are going to evaluate where we are. It's now the first week in June. and it does expire at the end of June, and we will continue to assemble information and get this HOPE program going. I'm going to let Laura Hogshead talk a little bit about how it's helping and how it works with the eviction moratorium. Laura?
Thank you for the question. So in the first round of the HOPE program, we assisted more than 36,000 households with rent and utilities. And what we know about the intersection between the HOPE program and the eviction moratorium is that if you are an applicant to the HOPE program, you are protected under that eviction moratorium. So we need landlords to sign the paperwork. We need landlords to participate in order to get the payment that they are due from those tenants that have fallen behind on rent so that they get caught up and that we're not so dependent on the eviction moratorium. But we do know that there are more households out there that need assistance, and especially as the moratorium is slated for either renewal or expiration, we need to make sure that as many folks as possible get into the program and get that check so that they can get caught up and get on with their lives. Thank you.
Next question, please.
Our final question today is from Helen Chickering with Blue Ridge Public Radio.
Thanks so much for taking my call. I have a question for Dr. Cohen, and we get listener questions, and we've gotten a number of listener questions from listeners who've gotten the Johnson & Johnson vaccine who are now worried they are not adequately protected, noting that now that mask mandates have been dropped, a lot of them say their understanding was the less effective J&J vaccine would be fine as long as mask and social distancing precautions were kept up. So the specific question is, should these listeners they want to know, do they need a booster dose or should they get another shot of the more effective mRNA vaccines for better protection? Thanks.
Helen, thanks for that question. First, I want to start by sharing I got the Johnson & Johnson vaccine. All 3 vaccines are free, they're safe, and all 3 are effective at preventing COVID and preventing you from giving COVID to others. You have to remember that these vaccines were both researched and put into clinical trials at different points in this pandemic. So it is really hard to look at effectiveness side by side of these vaccines. What we know is all of these vaccines are incredibly effective, again, at protecting you and others. It's why I made the decision to get that vaccine for myself. And so what I would say is that if you are vaccinated with any of those vaccines, you can feel protected, and the CDC guidance is if you've taken any one of those 3 vaccines, that you no longer need to be wearing a mask and doing social distancing either indoors or outdoors. If you are unvaccinated, though, you are still at risk. And I want to just remind folks to continue to wear masks indoors if you are unvaccinated. But if you have the Johnson & Johnson vaccine, you are protected, and we encourage folks to get the first vaccine that is available to them. Some folks getting the Johnson & Johnson is really advantageous because it is one shot and then they are done. I want to address the question about boosters. I think that is something the scientific community will continue to evaluate whether we will need boosters for any of the 3 vaccines. We'll look at 2 different factors: how long your immunity lasts with these vaccines, and does this virus change, which would make us need to get a different type of protection as we go forward. I think, and I have said before, I think boosters will likely be necessary in the future, similar to how we get a flu shot every year. I don't know if that will be here in this year, in 2021, or in the coming years, but that's what the scientific community will continue to evaluate as we go forward. Thank you.
Thank you all for joining us today.